Vitamin D, better known as the sun vitamin, is one of the essential vitamins needed by the body. It plays a vital role in promoting bone and dental health, supporting the immune system, and promoting optimal absorption of calcium and phosphate. In this video, we will explore everything you need to know about vitamin D, from its importance and benefits to its sources and how to avoid its deficiency. But before we start, don't forget to subscribe to the channel. Let's go. What is vitamin D? It is a fat-soluble vitamin that is synthesized in the body when the skin is exposed to ultraviolet sunlight. It can also be obtained from certain foods and supplements. The importance of vitamin D. Vitamin D is necessary to maintain healthy bones and teeth, plays a role in strengthening the immune system, maintaining calcium and phosphate levels in the blood. The benefits of vitamin D for the body. Bone health. Vitamin D helps regulate calcium and phosphate levels in the body, promoting healthy bones and teeth. It contributes to the prevention of bone diseases such as osteoporosis and rickets. Strengthening the immune system. Vitamin D enhances the effectiveness of the immune system, helping in the fight against infections and inflammations. There is evidence to suggest that vitamin D deficiency may increase the risk of respiratory infections. Vitamin D plays an important role in regulating mood. There are studies linking low vitamin D levels with increased rates of depression and anxiety. Vitamin D helps in the production of serotonin, a neurotransmitter that plays a key role in regulating mood and feeling happy. Prevention of depression. People who are deficient in vitamin D are more prone to depression. Research suggests that vitamin D can have a protective effect against depression, as it enhances mental health and helps prevent mood disorders. Improve mental performance. Vitamin D has a role in improving brain function and mental performance. It can affect the ability to concentrate, learning and memory. Studies suggest that vitamin D deficiency can be associated with a decline in mental and cognitive abilities, especially in the elderly. Symptoms of vitamin D deficiency. Bone and muscle pain. Vitamin D deficiency can cause bone and muscle pain, especially in the back and legs area. Fatigue and exhaustion. People suffering from vitamin D deficiency may feel tired and exhausted on an ongoing basis. Weakened immune system. Vitamin D deficiency can increase a person's susceptibility to infections more frequently. Sources of vitamin D. Exposure to sunlight. Exposure to direct sunlight is considered the primary source of vitamin D. It is advisable to be exposed to the sun for 10 to 30 minutes several times a week, paying attention not to overexposure to avoid UV damage. Foods rich in vitamin D. Vitamin D can be found in fatty fish such as salmon, tuna, mackerel. It is also found in fish liver oil, eggs, especially yolks. Fortified foods. Some foods are fortified with vitamin D such as milk and breakfast cereals fortified with vitamin D. Examination and treatment. How to check. Vitamin D deficiency can be diagnosed with a simple blood test that measures the level of 25-hydroxyvitamin D. Screening is recommended to be carried out periodically, especially for people with risk factors for deficiency. Appropriate treatment and dosages. Treatment involves taking vitamin D supplements based on the doctor's recommendations, increasing exposure to sunlight, and increasing the intake of foods rich in vitamin D. Recommended dosages. The recommended doses of vitamin D vary based on age and health status. Children, 1 to 18 years 6001000 international units, IU, per day. Adults, 19 to 70 years 600-2000 IU per day. Elderly, 70 years and older 800-2000 IU per day. A doctor should be consulted to determine the appropriate dosage based on individual needs. Prevention of vitamin D deficiency. By adequate exposure to sunlight and eating foods rich in vitamin D deficiency can be prevented. Supplements can be taken if vitamin levels are low. The importance of consulting a doctor. It is necessary to consult a doctor to determine the appropriate dosage and to take the necessary tests, especially if you have symptoms of vitamin D deficiency.